Good afternoon, everyone. Bonjour à tous. Thank you for joining us. Merci d'être parmi nous aujourd'hui. My name is Kina Leclerc and I will be your moderator. Je m'appelle Kina Leclerc et je serai l'animatrice de ce point de presse. Before we begin, I'd like to go over a few items. A reminder to place your phone on mute until I invite you to speak or to ask your question. And please do not place the call on hold. Available for questions from the media, we have, disponible pour répondre aux questions des médias, nous accueillons. In Council Chambers, Mayor le Maire Jim Watson, Steve Kanellakos, City Manager, Directeur Municipal, la Docteure Vera Etches, Chief Medical Officer of Health, Médecin-Chef en Santé publique, and Anthony DiMonte, General Manager of Emergency and Protective Services, Directeur Général des Services de Protection et d'Urgence. And phoning in today, we have Councillor Keith Eglai, Chair, Ottawa Board of Health, Conseiller municipal et Président du Conseil de santé d'Ottawa, and Pat Scrimger, Director, Transit Customer Service Systems and Planning. Directeur, Système Client et Planification du Transport en commun. I will now invite each agency alphabetically to ask their question. You may ask one question with one follow-up. Par ordre alphabétique, j'invite maintenant chaque organisme à poser une question et une question de suivi. So we will now begin with Chris Curries at 1310 News.
Good afternoon, everyone. I just want to follow up a little bit on schools. I know the province just recently released their plans if a child tests positive for COVID-19. I know, Dr. Etches, you touched on that a bit this morning, but I was hoping you could elaborate a bit on how will Ottawa Public Health kind of handle that situation and how will they go forward?
Thank you. The important step when a child tests positive for COVID-19, first of all, is to make sure that they stay home, that they aren't in school until the time passes when we know that they can't pass that on to anyone. Of course, the second thing is to make sure that anybody who could have been exposed and is incubating the virus is then also excluded from the school environment so that we stop transmission from occurring in the school. That means that we would draw on our public health nurse to help verify with the school all of the close contacts, whether they're students in the classroom, teachers, occasional teachers that come through. The schools are keeping records to know, who's been in contact with what cohorts. Those children or adults who are then home would be asked to go for a COVID test if they've been exposed to COVID, and the time period would be at least 5 days after that exposure to make sure that they know if they have an infection, and then also watching for symptoms, to make sure again for all of us, if we have symptoms that we're not at work, we're not at school, we're staying home, and we make sure we rule out COVID. So if we start to see other cases arising in a school, we'll need to take them one at a time to investigate any links between them, and we'll expand investigation as required and recommendations for more classes or schools beyond that point. So we know there's many places people can be exposed to COVID and pick up the virus. They can be at home, they can be in workplaces, and we're all linked. But that's the general approach.
Perfect, thank you. And to the mayor, small businesses, they've struggled during the pandemic. You mentioned that once patio season is over, colder weather hits, that help from the city is coming. Could you explain what kind of help that may be?
Thank you for the question. We're looking at a whole range of ideas. One idea that's been brought forward is how can we allow these fire pits, for instance, that you see in some jurisdictions around the world, or heating lamps that are heated by propane that can keep a patio open a little longer. We've reached out to the small business community through the BIAs, the Board of Trade, Invest Ottawa, and our other partners like Ottawa Tourism, and they're compiling ideas now from other jurisdictions or their own ideas that they've seen that will help them financially in those difficult cold months and winter months. So we'll be able to bring forward some suggestions. Some will require a bylaw or regulatory change, and others will just be able to be implemented. But we have had certainly a great deal of success. We've seen, I think, over 300 more patios open up this summer, which has been great. But as you know, patio season is relatively short in our climate, and we need to do whatever we can to help them, those men and women in the small business community with their struggle on a go-forward basis come October, November, and December. Thank you.
Thank you.
Thank you, Chris. Moving on, we will go to CBC Ottawa, Kate Porter.
There you go. Hi there. My first question is for Mr. DeMonte, and it relates to the mandatory mask bylaw, but more so the high-risk zones. I wondered if you could explain what are you looking at when it comes to having an order? Is it something like, a Britannia or a market area where everybody would have to wear masks? I just wondered if you could expand on that part of it.
Certainly, Kate. So yes, it's exactly that. So an area that we would identify that high congregation of people, and we would want to limit to the time to just when specifically there is a high risk. There's a whole a bunch of checks and balances in the bylaw. First and foremost, Dr. Etches, in her medical opinion, identifies an area of risk. Bylaw officers would be seeing congregation of people in the public space. So we would define what that area is, what time it's at. So like a Clarence Street or something like that, that there would be a lot of people between 10 and 2 in the morning. Then we would put that order in, and people would have to wear masks there. So it gives extra tools for bylaw officers or police officers to ensure that we're controlling that risk. And then after those periods during the day, there wouldn't be necessarily that zone that would require having a mask. So it's exactly as you described. It's for those type of events.
Perfect. My second, sorry, it's just feedback. My second question is a different one. It has to do with the OC Transpo and COVID cases. Perhaps it's for the mayor. I'm just wondering how concerned you are. The union is asking to get to the bottom of just why so many OC Transpo employees have contracted the virus. How big of a concern is this?
I'll ask the city manager. I don't believe Mr. Manconi is on the line. Steve, do you want to respond to that? I can give you certainly, obviously, a general comment, Kate, that obviously very concerned because we want to make sure that both our employees and our customers on the buses and trains are not in contact with people who are sick or carrying the virus. And we've taken a number of steps in terms of double cleaning each bus and the plexiglass barrier between the driver, mandatory masks for both employees and drivers themselves. And I believe John or Pat are on the line that could further expand on that question. Pat, John?
Yes, thanks, Mr. Mayor. It's obviously something we continue to watch closely, making sure that all of our colleagues remain as healthy as possible. The current statistics are that there's 18 active cases, colleagues of ours who have not yet recovered, and that's out of the almost 3,000 employees at OC Transpo. But it remains important, and everyone here is working to make sure that they all remain safe and considerate of their coworkers and adhering to all of the public health advice that we get from OPH.
Thank you.
Thank you very much, Kate. Moving on, is there anyone from CTV Ottawa on the line?
Hi, it's Josh Pringle.
Go ahead, Josh.
Thank you. Just following up on Kate's question about the COVID hot zones, has there been any specific circumstances that led to this, or is to giving the general manager the authority to enact a hot zone, or is this just something you want to have in your toolbox in case something comes up in the future?
Well, certainly twofold. We had initially in the market that kind of in-between situation where as we were opening some of the patios and they weren't able to take as many people, we had influx on the street, and we started identifying that could become a problem, although that was corrected quickly. We are looking at as having that tool in our toolbox. We're looking at, frost week, could be other circumstances if we open other areas of the city, or more importantly, if we identify an area that becomes problematic, we want to have that tool in our toolbox, as you describe, and I think it's a very good description because as the bylaw, mask bylaw was passed, even without this, as you can see, education was our first goal, and this will continue, but it gives us in those broad public areas another tool that we can use if we have to. So it very much is something that we want to have in case we need it.
Est-ce qu'on peut l'avoir en français?
Well, basically, the tools that we'll have available to us in our toolkit are designed to support Dr. Etches and her team at Ottawa Public Health and to make sure that the public health needs are met. So if we identify a place, an area, where people are gathering together, not wearing masks, etc., in a public space, we can create a specific designated area where the wearing of a mask is compulsory. That won't be our first step, of course, but this tool does give us the ability to impose that requirement if necessary. But what we tend to focus on generally is re-education. And this allows us to meet our public health objectives mainly.
Do you have a follow-up?
Avez-vous une question de suivi, Josh? Oui, une question pour la Dr. Etches.
We're talking about how household contacts has now been the main source of transmission. Is this a case of people just not following the COVID-19 guidelines, or is there another reason beyond that you've seen a spike in the household contacts for cases?
Thank you. I think across the board, people are doing their best around physical distancing. Generally, with people they don't know, it's sometimes hard when people start to get into the group that they do know and they're used to seeing more frequently or socializing with, and it gets harder to remember to keep the 2 meters apart, to limit that close contact. It's not always. It doesn't feel quite as normal when you go to the grocery store. You wear a mask, but maybe you don't with your neighbors or somebody that you're closer to. So it is that kind of behavior that is more on the social side of our lives, not the work side, where we're seeing that one case leads to another case. And again, it's tricky because when someone has the COVID virus, they don't always know. By the time they start to feel sick and go to get tested and it's confirmed, it's quite likely it can be already passed on to others, and so that's what we're seeing. Then the cases grow. So again, trying to limit that to catch up and stop the transmission when we identify it through that contact tracing, but also get the message out. We're better off if we prevent infections in the first place, and so do keep in mind outside of your family or your household contacts, that it is important to continue with those practices of distancing when we visit, to socialize wisely, I guess.
Thank you, Josh. Nous allons maintenant passer à...
We'll now move on to Franco Press, Ines Lombardo. Are you there, Ines? Are you there, Ines?
Craig Lord at Global News.
Thanks very much. I'll just go to Dr. Etches if I can. Just kind of a clarification on what you said during council, that there's been no outbreak so far at bars or restaurants or gyms, places where we have masks mandated. Do we know that there's been no transmission between individuals in these locations, or is it just possible that people are contracting the virus here, but they don't know where they're picking up, and therefore it's not registering kind of an OPH system?
Thank you for your question. We know that we aren't picking up every person who's infected with COVID-19, because not everyone realizes they're sick enough that it's warranted to go for a test. So I would say there is a possibility that our data just isn't showing some of the links that are happening in these places. But it is encouraging that of the people who have tested positive for COVID-19, we haven't been able to link that to transmission in a bar, a restaurant, or a gym. They are high-risk settings, so the opportunity is there if people aren't practicing, following the measures that we put in place to do things differently in those venues, to stay seated, to wear a mask when you're not eating or drinking. These things do make a difference, and are protective because the risk exists. These are higher risk settings. We'll continue to communicate as our data evolves if we see something different.
Great. And just a question maybe for Mayor Watson. With people increasingly going back to work and school starting again soon, are there any plans to start having council meetings in person, or any of the various committee meetings in the same room?
Yeah, the city clerk is actually putting together a report, and not really an in-depth report, an update on where we stand and his advice as to whether we should continue these meetings. I think certainly for the next couple of meetings we'll continue with Zoom. It's not an ideal situation, but I think we should continue as best as possible to stay apart. If you see here in the council chamber, they put up some plexiglass dividers and so on, so they're preparing for us to eventually come back, but it'll be up to the clerk to bring forward a recommendation sometime in the next month or so. Thank you.
Great, thank you.
Thank you, Craig. Nous allons maintenant passer à
Julien Paquette from Le Droit newspaper. Hello. I'd also like a response in French to this question, but I'll ask the question in English nevertheless.
Mr. Kanalakis would be the best person to answer. I was just curious because you mentioned in your report that there's been financial help from provincial and federal government announced in the last few weeks, but there's still a significant deficit on the horizon for the rest of the 2020 budget year. How do you plan on going forward if there's no more help coming until the end of the year?
No, thank you for that. We've already indicated to council that with the money that we have, we've got funding for about 65% of the projected deficit that we were looking at for 2020. Right now, we believe that based on the measures that we can take, we've frozen hiring, for instance, we've frozen discretionary spending. There's obviously no travel. Our overtime is down significantly. Our sick leave is down significantly. So we're seeing savings in other areas. Our investments as a city are actually a little better than what we were forecasting as the markets have bounced back since they collapsed in March. So there's a number of things that are contributing to making up that gain for us, but that we believe for 2020 we can come to a balanced budget. The challenge is going to be 2021, because if the revenues don't come back and we don't get federal provincial funding flowing to the city in our second wave of our second phase of funding, then we might have to take more harsher measures to try and balance the budget, but that's something we'll be tabling with Council in November when we table the budget. But I'm very confident that for 2020, the city can come in with a balanced budget. We have to make some sacrifices, but we don't have to do anything harsh because there's a number of one-time measures, as I said, we can take that can take care of the budget. And if we do get money by the end of the year, early January, from the province, so the second phase application, then we're in good shape for this year, and we'll have a better position to head into 2021 with.
Thank you.
My second question is for the Mayor. I'd like to hear what you have to say about the symbolic nature of the motion that was adopted on Mr. Shirelli's salary. Yes, I support Ms. Sudd's motion. I think it's a good initiative. It's the right thing to do to give his salary to groups like the Rape Crisis Centre, sexual assault help groups as well. It's not only symbolic, but it's real action. We're stepping up to the plate. We're talking about $100,000 here. And that money's been given to groups that help women in crisis. It's a good initiative, I think, that Jenna Sudds put forward, and all councillors voted unanimously in favour of that motion. Thank you. We'll send you the answer in French later.
John Willing at the Ottawa Citizen.
Hello, I think it's a question for possibly Mr. Scrimgeour or Mr. Kanellakis. It sounds like the province is putting some strings on the next phase of transit operations funding. I believe I read something about requiring agencies to consider microtransit options for low ridership routes. So I'm wondering what Transpo has in mind to satisfy that potential condition.
Thanks for the question. Yes, they've given conditions. I'm just I think I have it here. I can pull it up on the screen and refer to it. I saw it here a second ago.
Pat, I have it. I have it if you don't.
I've got engage in. So they've require us to engage in consolidated procurement opportunities, leveraging Metrolinx and other provincial procurement tools, which we have done already to some degree with the purchase of our 40-foot buses and with the purchase of our Presto smart card system. They ask us to review the lowest performing bus routes and consider whether they may be better served by microtransit. We will certainly be doing that as part of the review that Mr. Kanellakis mentioned of possible ways of addressing revenue shortfalls. It says also work with the province and Metrolinx where appropriate to determine the feasibility of implementing microtransit options and viable routes. So we'll be following up more with them to understand what they have in mind there.
Thank you, Mr. Scrimgeour. I guess as a follow-up, I would ask, is the city OC Transpo interested in partnering with ride-sharing agencies like Uber and Lyft to provide that microtransit option?
I think there's, first of all, there's many definitions of what microtransit is, and then there's many approaches on once you select a method of what your concept of microtransit is. There's questions about what is good, what is affordable, what is appropriate, and then there's different means of acquiring those services or operating them internally. And if it were to be a procurement, then any qualified company would be, of course, able to make a proposal.
Thank you.
Thank you, John. We will now go to Jérôme Bergeron.
Jérôme Bergeron, Radio-Canada. Hello. My question is for Mr. De Monte. I'd like some detail on the wearing of masks outside. Are you targeting places where this will be made mandatory? And in what circumstances would you be ready to actually impose the wearing of masks outside? Well, our objective is to improve our public health situation and to stop COVID-19 spreading in the community. One of your colleagues mentioned the following example: the market. Restaurants, very often we see people outside these restaurants not wearing masks, so we'll be able to use this tool to make sure that they're required to wear masks even outside the restaurant. Now, the methodology identified in the delegated authority has conditions attached to it. Dr. Etches and her team has to determine formally that, in their opinion, it's a public health issue. I get that in writing from her, and then, even if I issue an order, it's only applicable for 60 days. The order has to be limited to a specific geographic area. It wouldn't cover the whole market, just a specific area of the market. And it's also limited, it's time limited from 10 in the evening to 2 in the morning, for example, so it wouldn't be compulsory during the day. So it's pretty prescribed. And when we identify there's a need, it's only used in a prescribed fashion. Now, this tool can be used across the city. If we had the same type of case on Bank Street or Elgin Street or Parkdale, we could use this new tool. So for the time being, you haven't yet really designated an area. But if there is an emergency, if there is an incident, you might designate a specific area. Is that the way it'll work? Yes. My question for Ms. Etches now. I'd like to know, well, this morning, during the council meeting, you said that there really haven't been outbreaks in bars or in restaurants. Could you explain in French of where COVID outbreaks are occurring here in Ottawa and where people are being affected? Well, this morning I explained that we're not facing a situation of confirmed outbreaks in bars, restaurants, or gyms. These types of places are at higher risk, of course. Why? Well, because activities are higher risk activities. Especially if specific precautions are not taken, like the wearing of masks, etc. So this sort of exposure to the virus is more in social type situations, among members of the same family, among neighbors, friends, where it doesn't feel normal to maintain social distancing or to wear a mask inside. Now, all that protects against the spread of the virus, against infection. It's important to limit your close contacts to avoid this type of transmission. Thank you. Thanks very much, Jérôme. I've been told that Ines was having technical problems. Are you there now? Yes, I'm here. I'm here now. Thank you. Hello, everyone. I have a question. University students, what about students enclosed inside spaces in schools? University classrooms are the same. Will students be required to wear masks in classrooms in universities? I could perhaps start, but I think my colleagues might want to add additional information.